Hello, Mr. Smith. Happy to see you back again at my clinic. How are you doing? Okay. Mr. Smith, as I'm seeing through the file, about 3 weeks back you were diagnosed as a Parkinson disease and I prescribed L-DOPA medications, which is L-levodopa in combination with carbidopa. Is that right? Okay. So, Mr. Smith, how are you doing today? Okay. So you are taking the medications regularly? I know you have still the muscle spasms which and in the left foot, and I can understand that. I'm really sorry to hear that about that. And what about the tremors itself? Okay, the tremors have reduced. Okay, are you compliant with the medications? Are you taking it regularly, or you have skipped some of it? I know that in the previous session you were quite reluctant about those medications. Okay, Mr. Smith, I understand your concern that these medications, you feel that the side effects are severe enough, you feel drowsy, you sometimes have headache and these things. I can understand that, totally understand that. I'm really sorry to hear regarding this. But actually, L-Dopa by itself is one of the important medication for Parkinson's disease itself. Pretty sure that it will improve the symptoms, yeah, and it will improve the general prognosis of the condition also. You know what? Parkinson's disease itself is a degenerative disorder of central nervous system, and what happens is that your motor skills and speech and function reduces with the passage of time. So what L-Dopa does, these medications does, is that it reduces the symptoms of your problem, and by itself this will that your condition will quite dramatically improve if you are compliant with L-carbidopa or and levodopa. um, I think you understand. You are quite careful with your pretty much living standards and taking care of yourself quite effectively at this age. I find you are a fit person. I can understand your concerns that you are suffering from Parkinson's disease, and that's quite debilitating by itself. You know, this diagnosis of having a chronic disease itself makes you quite depressed. Yeah, yeah, I can understand that. Regarding the mechanism of how this happens and why it happens, it has multiple reasons. It can have multiple reasons, but um, I was not able to take out anything from your previous history. Most of the time, we cannot explain the cause itself, whether it is genetic, head trauma, exposure to any toxins. Most of the time, it's iatrogenic. What it means is that there is no need, no unknown, no known etiology itself for the cause of this disease. Um, what I would recommend is that you can go on for physiotherapy itself. Physiotherapy will help you to have improvement of your gait. That is very important, and help you in the movements and reduce the spasm as well. And it will also improve the pain itself, and you will those breathing issues and those tiredness, it will improve with physiotherapy itself. I know that you are interested in those other forms of exercises and activities like acupuncture. I appreciate that, but it is no way an alternative for your medications itself. Yeah. So would I believe that you will be compliant with your medications? Yeah, you need to continue with these medications. I know the side effects. You can keep on coming to my clinic and let me keep reviewing your file. But as I'm pretty sure your diagnosis is confirmed already as Parkinson disease, these medications will dramatically improve your living standards, and you will be able to do activities of daily living quite effectively. Okay, sir? Thank you.